Sure. Real quickly, my name is Dr. Chris Clark. I'm the Program Director for Masters of Athletic Training. So this is Samara Kilgore. She is going to present on re-injury with ACL. So we've already had an ACL presentation, but it's a different topic. It's focusing on return to play. So I'm going to turn it over to you and let you go for it. Thank you.
All right. Good afternoon, everybody. I am Samara Kilgore, and as he said, I will be answering the clinical question, does the fear of re-injury in athletes after an ACL reconstruction negatively affect their return to play process? So just an introduction to start off, what is an ACL injury? I know this question was already answered a little bit earlier today, but an ACL injury is an injury to the anterior cruciate ligament. That ligament is in the knee, and it's also to stop anterior translation on the tibia from the femur. So there are about 7 million injuries in sports every day, or every year, I'm sorry, because that would be a lot. And of those 7 million injuries, about 66% of them happen in the lower body. And the most common injured part of the lower body would be the knee, and within the knee, about 50% of those injuries just happen to be ACL ruptures. So fear is a basic emotion that all creatures feel. It's usually based upon past experiences, and it's actually socially constructed. So from what I found when it comes to, in relation to research, you can actually choose what you fear or what you don't. It's all up to you. You can choose to be scared of something, or you can choose to be not. It's one of those just mental aspects when it comes to sports and everyday things in life. So these are just some pictures of an ACL injury. To the left, we have a complete rupture of the ACL, and on the right, we have a partial and also complete tear, just to give you a visual. Okay, so my focus clinical question, again, is does the fear of re-injury in athletes after an ACL reconstruction negatively affect their return to sport process? The population that I'm looking at is athletes with ACL reconstruction. The intervention would be the fear of re-injury. I also do not have a comparison, and my outcome would be whether or not the athlete returned to play. So my search strategies, what I use to find these articles, I use Google Scholar, PubMed, my JSU library, and Sports Discus. Some of the phrases that I used, I didn't have a lot of words, one-liners, but some of the phrases that I used were kinesiophobia in athletes, with ACL reconstruction just in general, kinesiophobia, and a fear of return to play in athletes after an ACL reconstruction. So things that I wanted in the articles were talked about ACL ruptures. I needed them to be athletes, kinesiophobia. I needed them submitted in English because unfortunately I do not speak another language. And I needed them dated after 2011. Some things that I wanted, that I did not want in my articles were combined knee ligament injuries. I didn't want any other psychological condition and studies that did not include athletes. It was pretty important that I had athletes in these. Okay, so I had 3 articles, and I'm going to tell you them next. And my evidence quality, they were all really good articles. They were levels 1 and 2, which are the highest levels of evidence when it comes to evidence. So my first article, it was the fear of re-injury in athletes. The purpose of this article was to establish the prevalence of fear with clinical methods to measure it. So this article found how exactly fear impacted rehab outcomes and such as physical impairments, function, whether or not they did return to the sport, and potential interventions to address fear during rehabilitation. Because if you address the fear, if it is something that we can manipulate, it will help with the return to play. So ultimately, it found that the fear of injury after a sports injury can negatively affect the recovery of physical impairments, reduce self-reported functions, and prevent a successful return to sport. So the second article that I had, the name of it is Factors Informing Fear of Re-Injury After after ACL reconstruction. So the purpose of this article was to actually find people who did not return to play solely because of the fear that they had of re-injuring their ACL. So what we found from this was there was 4 main themes, and they were undergoing the surgery and recovery process. That's the number one reason why most people were scared to return to sport. The nature of the sport, imposing the risk. So again, like my classmate said, females are more at risk, and a sport such as soccer, female soccer would be a huge risk. So it was found that female soccer athletes may not want to return to sport because of the risk, personality traits, and social priorities as well. My last article was the National Athletic Trainers Association position statement for the prevention of anterior cruciate ligament injuries. So the purpose of this article was to provide certified athletic trainers, physicians, and other healthcare workers recommendations based on evidence regarding the prevention of ACL injuries and how they happen. So the results from this article came about. The multiple component injury prevention training programs are recommended for reducing the prevalence of ACL injuries. So my clinical bottom line, answering my question, was yes. Fear of re-injury does negatively affect the return to play process for athletes, and if left untreated, can lead to an athlete never returning to their sport. So in conclusion, again, yes, fear of re-injury will and can negatively affect the return to play process. There were 4 reasons noted the most as to why people did not return to play after an ACL injury. Those 4 were surgery and the recovery process. People just didn't want to go through that again, and it's very expensive. So surgically reconstructed ACLs can range anywhere from $5,000 to $17,000 per patient, but long term, it's estimated about $38,000 per patient. The nature of the sport, again, the risks, so soccer, football, volleyball, females, and personality traits and social priorities. And then lastly, addressing the modifiable fears, including things like pain, mode and length of rehabilitation, psychological factors. It should be addressed during rehabilitation, and this will potentially improve the return to sport rate. Here are my references. And I would like to thank my classmates, JSU staff, and my preceptors who've helped me improve thus far. And I'd also like to thank the JSU Symposium for the opportunity to stand, and the judges for listening, and everyone else.
Do we have any questions?
I always have a question. Thank you very much for this presentation. What brought you to this topic specifically?
I'm sorry?
What brought you to this topic? What sparked your interest?
I've just always found it interesting that ACLs are major injuries, but I've just wondered always, like after an athlete gets injured, do they ever have any reservations about going back to the sport? And sometimes you see, I've done a lot of work with football, so sometimes you have athletes who seem like the biggest, strongest people in the world, but there could be one thing limiting them from meeting their full potential or getting back to their full potential. And something as small or as big as fear can do that, and so that's what brought me to the topic.
Thank you.
What factors do you think would help to overcome this fear or just push through it?
Great question. So when it comes to overcoming fear, there's a multitude of things that could help. So one, talking to a therapist. Some people have a fear of talking to a therapist, or some people don't want to do it as if makes them look some type of way, or just anything like that. But talking to a therapist can be very beneficial. Or people as athletic trainers can give small bits. Family is very important. Putting the athlete in a different mind frame, so taking them to a happy place or something like that. There's a multitude of things that can affect fear and help to overcome it. Those are just a few.
Okay. If no other questions, round of applause again.